Hello and welcome to Wellness Wednesday. I'm James Currie with the Communication Department here at MCHD, and I'm talking to John and Deirdre there with the Overdose Prevention Program. How are y'all doing?
I'm doing good today. Thank you for asking, Jane.
I'm doing good myself, James. Thanks for asking. How are you, sir?
I'm good. Never better, as they say in this industry. Uh, so y'all are here for September. Now, September is a special month for your program. Can you tell me about the month of September?
Well, September is National Recovery Month, and we work for the Overdose Prevention Program here at MCHD. And part of what we do is we try to spearhead efforts to get people into treatment and services and resources that'll help them to live a better life.
Now, y'all are also your program and the information on your program. I'm looking at my MCHD app here right now, and you can download the app. That QR code that's over my shoulder there.
Right.
But you all are right there on the main page of the app, and there's sections in the app for overdose awareness. So someone can go to the app if they want to know information about Narcan. Um, and then how to contact you all as peer recovery specialists.
Yes.
And then
yes.
if they're looking for substance use treatment, there's a locator there too. So
Yes.
there's a lot of useful information of your program within
Right.
the app. So tell me specifically what you all do as far as outreach, as far as being two specialists. What do you do? Where do you go? Who do you talk to? Tell me about the program.
Well, basically, what we do is we use data that's been generated by other divisions of our program, and we go to those particular spots and we create intervention strategies. We go to outreaches, we go to community fairs, we go to health fairs, we go to other providers outreaches, school apps, the school days, just to get that messaging out there that there is help for substance use disorder and overdose. And we just get that messaging out. And actually, we serve all of Mobile County and surrounding counties.
Now, you also have there's a little brochure that's also available through the MCHD website, your section on the MCHD.org website. That's the There Is Hope, which is the recovery booklet that you all
Right.
have at outreaches. But that information is also too, like I mentioned, in the app. So,
Right.
But the section on Narcan, now tell people why that section is there, why you talk about it, and why it's important.
Well, one of the things that we established early in this process was that a lot of people are overdosing on fentanyl. It's become the #1 overdose drug in our community, and Narcan reverses overdose from opioid use. And so we think it important that everybody has access to that particular life-saving drug because it reverses an overdose. We don't carry Narcan, we don't distribute it, but we do make the resource available for everyday Johns to get a dose of Narcan. We think that everybody should have at least 1 or 2 doses in their homes, in their purses, in their cars, because you never know when you're going to encounter overdose. And we put information in the book that will help people to be able to recognize the signs of an overdose: shallow breathing, discoloration of skin, just all the signs that point to overdose. And because illicit fentanyl is in our area and it's widespread, we think that that Narcan messaging is important, especially this time of year.
Now, when you go into the school systems, are the kids kind of, are they smarter than we think that they are, sort of thing?
I think that the people that are putting the fentanyl and the illicit drugs out on the street are starting to to be a little bit more smarter, because they're starting to disguise it in different colors and packagings to make it look like candy and appetizers and different things, and it's no longer looking like pharmaceuticals that everyday children would stay away from. They're putting it in candies and brownies and just all kind of pills. Sometimes you think that you're buying one kind of pill and it's actually illicit fentanyl.
Yeah, I'm impressed.
So
yeah,
that's kind of what we do.
yeah. So you've got some statistical numbers there to kind of back up the evidence-based information that you all use to go out and go speak in the school system or go do a
Right.
presentation somewhere. So can you
Right.
throw some of those stats back to me about
Well,
got?
I do have some. I have some information from SAMHSA, which is the Substance Abuse and Mental Health Services Administration arm of the federal government. And what they talk about is that 50% of all Narcan uses end up in overdose, in deaths. And Alabama still prescribes 14% more prescription opioids than the other 3 states around it: Georgia, Arkansas, Florida, and Mississippi. So, here in the state of Alabama, we still prescribe 14% more prescription drugs, and the number is lower because of restrictions and laws and stuff like that, but we still prescribe 14% more opioids than our neighbors.
Mhm.
So that's why it's so important, and that's not even taking into consideration the illicit fentanyl that's out on the street, that's being channeled through illicit markets and whatever. So we're still dealing with the opioid epidemic, and it's not going anywhere. Even though we're doing better, there's still widespread opioid use in our community.
Now, Deirdre, tell me about some of your outreaches. Are you also in touch with the school systems, the police departments, jails, or any of those things? So tell me about that.
Yes, we go out into the community when they have, we go out to different schools in Mobile County, and we talk to like from middle school and high schoolers, and we tell them about, and you said earlier, are the kids like smarter than us?
Mhm.
And so a lot of them are armed with information. I think we were at like maybe Viger High School or something of that nature, and the young lady, and we were talking about the fentanyl and the Narcan, and they was wanting to know, well, how can I get some Narcan? Because the girl said that her brother had taken a pill that he thought it was a Percocet, but it had been pressed with fentanyl and he died, so they are made aware of what's going on in the community, and they're concerned, and they want to get information on how they can do stuff to save somebody's lives. And so then we are out in the community. If it's a church and they're having a health fair or something of that nature, then we go out and we set up a table, and we are vendors in the community. We had like a overdose awareness walk last month, to at Mardi Gras Park, to make the community aware that we're here and what we do, and that we're able to do a warm handoff to other providers, right? Exactly. So we don't have necessarily the funds in our department to send someone to treatment, but we've partnered with other people that are able to help folks get the help that they need, provided that they want it. So we're here, or we can do one-on-one peer counseling with the person, and if they're willing to, because of John and I both are in recovery, and so thus we are peer recovery specialists. And so and we're just here to let people know that recovery is possible. Anybody, any family member, it doesn't matter what your walk of life is, doesn't matter where you come from or how far you've fallen. recovery is possible, and great things can happen in recovery, you know, because like John and I, after recovery, we both, you know, we sought higher education, and so, you know, we continue to better ourselves, and, you know, like where we didn't care about owning properties and things of that nature. So we today, you know, through this job, and I always say to people, like my little story goes that I've never worked anywhere for a real long period of time, but I've been here almost 4 years, and I say that Mobile County Health Department is the greatest show on earth. So I'm so grateful. I'm so grateful to be here, and this is an awesome place to work, you know, and where people give you an opportunity to use your talents and your gifts, and, you know, to help other people, because that's what our whole you know, the basis of this uh, establishment or institution is, to help people to live a better life. You know, we want them to live well, you know, and so we're just really awesome to be here. It's great to be here and to be able to help somebody know that recovery is possible for them. You know, you don't have to keep living in the throes of addiction. You know, you can come out of that, but it, you know, definitely has to be a choice, and we have to be sick and tired of being sick and tired. But we're always here. We're always ready to help. You know, and if anyone needs us to participate in a community activity, we're grateful and we're honored to do that, and to you know, just to get the word out there that recovery is possible, and that overdose prevention is here to help. You know, and we understand what you've gone through. You know, we know what you're going through. So all you got to tell us is, like another institution say, all you have to do is tell us your name and that you're an addict, you know, and how we can help, right? So that's where we are, and so yeah.
Well, I appreciate your sharing your story and your background, and we're fortunate to have both of you here. I know you all are rarely in the office because you're always out in the field,
Right.
you know, doing things and presentations. And so, just a moment ago, you said, you know, if you know all the things that you all go do in schools and health fairs and church events. So let's give people information how to get in touch with you if they do want you to come do a presentation at some type of function. So go ahead and give your contact information.
Okay, we can be reached at Mobile County Health Department by email, by phone. We have a 24-hour hotline, which is area code 251-410-6133. And we have we're making it greater access. We're having a website that'll be launched shortly. We have an app, like you said, on the Mobile County Health Department's app. We have a opening there, and we have cars. There's still a billboard or two around that I see with our number on. And again, that number is area code 251-410-6233. That's the number to the hotline. And the wonderful thing that like I said, we're making greater access to us. And I looked at the website, and I'm so excited for it to be launched, because on the website, there'll be a place for you to contact us directly. And it will go directly to an email, my email, my manager's email, or Deirdre's email. And that way, you know, you can ensure your privacy, and that you'll get straight through to us. So I'm excited for the launch of the website, and so just kind of be looking forward to that. Again, this information can be reviewed again on YouTube, on the YouTube channel. So just look for it. It's coming soon.
Yeah, you mentioned that just a moment ago. There may be other people out there that, you know, maybe they want to send you an email. They're not really comfortable with talking on the phone initially about this. So in the MCHD app, your section, the hotline number, and I'll mention that again, and your email address, it's 251-410-6322, and Overdose Prevention at mchd.org.
That's right. Correct.
All right. Well, thank you both for being on Wellness
you for
Wednesday and
Well,
talking
thanks
about.
for
Thank you for
having
having
us,
us.
James, in celebration of Recovery Month.
Mhm.
We appreciate you having us on and, letting us talk about this particular month that's near and dear to a lot of people's hearts.
Yes.
Yeah. Well, thank you for sharing the information. I know you both are a wealth of knowledge. You've got a lot of stats there, and you just love to go do presentations and talk to people. So anybody out there watching, just get in touch with John and Deirdre, and they will be more than happy to come to your event and be able to set up and speak and
Exactly.
just raise even more awareness in the public.
Exactly.
Yes.
Okay.
Exactly. That's
Well,
correct.
thanks
Thank you
again.
for having us.
Thank you, James.
Have an amazing day.
Appreciate it.
Thank you,
Appreciate it.
James.